and it's my pleasure now to introduce Dr. Richard Winter. He's a psychiatrist who spent nearly 30 years in the USA at Covenant Seminary. I was greatly blessed to read his book many years ago, and it was a great help to me, so I'm delighted to be introducing him today. He's now back in the UK, in Hampshire, enjoying grandchildren and other things, and we're really looking forward to hearing from you, Richard. So over to you.
Thank you. Welcome, everybody. The Pursuit of Excellence and the Perils of Perfectionism. It's great to be able to speak to you about this today. This is a speedy, somewhat light-hearted, and yet serious look at this topic. It's the illustrated version of my book. I've given you a lot in the slides because I'll be covering all this quite quickly. So you won't have to take notes and you can see them later. I want to give credit to Rob Waller and his book, the Perfectionism book. He gave a webinar on perfectionism in medicine maybe 2 or 3 years ago, and he recommended his own book and this other book by Roz Shafran and others. And I would strongly recommend these. We approach this very similarly, but with different, a somewhat different emphasis in each of our presentations. And it's no harm to double up on this subject because most of us find it hard to see our own perfectionism very clearly. So first of all, what is perfectionism? It is a strong desire to be flawless in appearance and performance and character. To be flawless in appearance, performance, and character. So this comes down to, what do we expect of ourselves? What are the external pressures from other people, from our social situation? And what are the internal drives that make us want to be so flawless? And what is healthy and what's unhealthy? You can see in the title that there is an implication that there may be some problems with some parts of perfectionism. There was a recent media attention given to an article about millennials in a psychological journal, that perfectionism was increasing over time. And it's believed to be in the general population, certainly in the UK and the USA, because that there's a sort of increase in pressure to have the right image, to show you've been successful, to have peer acceptance. And social media just enhances that, the pressure to sift and to sort and to rank each other. And for this reason, because we're all comparing, there is a greater incidence of depression and anxiety and imposter syndrome and anorexia and cutting and suicide. And we see this pressure to be perfect in a number of different areas of life, most noticeably and visibly in much of the world, in the pressure to have the perfect body. So the advertising industry and women's magazines and pornography too, it has been shown that viewing these things frequently make women more dissatisfied with their own bodies and men more dissatisfied with the body of their partner or their spouse. And men are not immune to wanting to boost the shape of their body and the size of their body with either workouts or hormones. And of course, we've been into the age for quite a while of cosmetic surgery, and the highest rates of cosmetic surgery tend to be in the beach culture worlds of countries like Brazil. Now, so that's in one area, the pursuit of the perfect body. Then in the technological world, we see a promise in the development of technology, the possibility and the potential for perfection in that beautiful Lexus that you might hope to own. And then we see it in many examples in relation to health and medicine, these promises of perfect health, of being able to get to heaven now, as it were, in relation to our bodies. And then the hope of perfect babies. We're already in a culture of deformity eradication. and of genetic selection. And we're moving into the world of nanotechnology, some of which, of course, can be very useful. We're surrounded by the promise of technology and machines that make our lives easier and more efficient, more enjoyable. We have high quality music and visual entertainment in our homes. We live longer and healthier lives. No wonder we feel the promise of technology. And for most of you, especially in the world of medicine, hard work, commitment, and discipline have been a part of your ethic, the thing that has got you where you are as a doctor. And if you add to that, then the pressure to excel. These things, the achievements of technology raise our hopes and aspirations. They stimulate our desires and our longings for perfection. And then we move on to the Olympic Games. And of course, the Olympics epitomize the search for excellence and perfection. Can I get that perfect 10 score? And the perfect 10 tends to be different each 4 years. And then in your own life, you may have had this progression through high school and college and graduate school and marriage and finding the perfect bride and having the perfect 2.4 children or whatever it is, and the dog, the Caucasian dream. And we need to ask, what is the Hispanic dream, the African, the Asian dream? But wherever it is, there is this aspiration to something better and more. And as we go on, especially in the United Kingdom or America, we aspire to that perfect house, that perfect kitchen. And one day we may be able to afford that perfect vacation in the Caribbean. And a little tongue in cheek here, but it was interesting. Some years ago, the advertisements for this particular gin were even a perfectionist needs a little variety now and then. Have at least one thing in your life that is perfect. And the irony of this is that some do give up. Some perfectionists give up and drown their frustrations and anger in drugs or alcohol. A social worker friend told me that, who works in New York City, that many of the men and women living in cardboard boxes there are failed perfectionists. They wanted to aspire to the American dream, but couldn't make it. So the promise of perfectionism surrounds us. And there's no denying, say these writers, that when you count up material comforts and remarkable achievements and other outward signs of success, perfectionism will seem to have served you well, especially in this day and age. We've been going through an era in which setting high standards and devoting an inordinate amount of time and energy to attaining them is considered a prerequisite for success. But, they say, appearances can be deceiving. Talking of appearances, that we typically, and I don't have time to go into a lot of the academic research on perfectionism, there is a lot. We typically divide perfectionism into appearance perfectionism, performance perfectionism, which speak for themselves, and moral perfectionism, which is sort of scrupulosity, your desire to keep the speed limit exactly and not go more than 2 miles an hour below the speed limit, lest you sin. And perhaps time clocks, you'd be very scrupulous about those. And then there are those who are all-round perfectionists, but you might be a perfectionist in any of these areas. So you have those types, and then we speak of the assets and liabilities of perfectionism. Perfectionism can be sometimes good and sometimes bad. Sometimes healthy, sometimes unhealthy, normal, or neurotic. And I like to speak of a spectrum of perfectionism, because these two tend to, it's not an all or nothing thing. As we'll see, that's an important distinction. It's a sort of graded thing. And we see this in one study that was done some years ago on high achieving, gifted sixth graders. But I think it generalizes out into the general population. That they found that 25% were dysfunctional perfectionists, the unhealthy ones. 42% were healthy perfectionists, 30% non-perfectionists. And those non-perfectionists, I think they describe them as disorganized, unreliable, lacking in self-discipline. But I think there are quite a number of non-perfectionists who are very laid back, easygoing, and they get along with everyone, and they're just great people. They just may not be as concerned about things that many of us would be concerned about. And that non-perfectionist end of the spectrum can be sort of summarized in these humorous posters. If you can't, the first one, ineptitude, if you can't learn to do something well, learn to enjoy doing it poorly. Or mediocrity, it takes a lot less time, and most people won't notice the difference until it's too late. So what is the difference then between unhealthy and healthy perfectionism? Well, unhealthy perfectionists, and I give you all I'm going to say on this, have standards that are high beyond reach or reason. They strain compulsively and unremittingly towards impossible goals. They feel their best efforts are never good enough. They're unable to feel satisfaction or joy in a job well done. And this is the key one. They measure their own worth entirely in terms of productivity and accomplishment. Their identity depends on reaching those high standards. So they're preoccupied with performance and or appearance. And you can feel just in this description, the pressure, the tension of living like that all the time. Compare this with normal, healthy perfectionists, what we might call people of excellence. They pursue excellence. They derive a very real sense of pleasure from the labors of a painstaking effort to meet high standards. They feel free to be less precise as the situation permits. They rejoice in their skills and they appreciate a job well done. Can you feel just the pressure eases off to be able to be less precise as the situation permits? Now, we also often talk about perfectionism as being driving or defeated. Now, this is the all or nothing again. The driving, active, productive perfectionist, which is sort of on the healthier end, but then the passive, paralyzed, defeated one. And we come back to this, the thought patterns of unhealthy perfectionists. The classic one that I run into again and again is all or nothing thinking. And we'll describe that as more as we go along. And then the need for control, because anxiety makes us anxious and makes us want to be in control. And one way of doing that is to work harder. The tyranny of the oughts and shoulds, someone has called the hardening of the oughtaries. And then excessively rigid standards and inflexibility. And the thoughts and feelings of unhealthy perfectionism, this feeling of I'm always failing, I'll never be enough. And the feeling of shame, I'm a bad person for not living up to my own or other people's standards. It's not just that I've done something bad. No, it's I as a whole person am bad. A constant feeling that I'm never there. There's something wrong with me. So there's an excessive concern over mistakes, doubts about actions, a sense of over-responsibility. And this leads, of course, to anxiety and worry. It leads to procrastination in finishing tasks, in finishing papers, in indecisiveness. You want to make the perfect decision in life, and you feel paralyzed because you can't make it. It leads on to excessive checking, list making, and organizing, to not knowing when to quit or giving up too soon, to decreased productivity and performance, a failure to delegate. And you notice excessive and giving up too soon. It's sort of a matter of degree, decreased productivity and performance. And that's more in the failure end of perfectionism. And then eating disorders, there's a strong association of perfectionism with eating disorders. And it's understandable that for a young family, they're longing to be accepted and loved in a lonely world, combined with a need for power in a dangerous world, and to be in control in a disordered world. And they want to keep things in control in one area of life, particularly, which is, of course, their weight, their body. And it can lead, it is a fatal disease in about 15%. And many people hover on the edges. And this poster here, Perfection, a beautiful fairy tale that always leaves you hating yourself. And then other things, it may lead to burnout, to depression and suicidal ideas. There was one surgeon, a superstar pediatric cardiac surgeon in the States, who did 830 surgeries over the course of just 18 months. And these yielded an incredibly low 2% mortality rate. This is a pediatric cardiac surgeon. He was universally admired. The Los Angeles Times called him a medical miracle worker. He ran triathlons just to stay in shape for the operating room. He flew out of state to harvest hearts personally. He called ex-patients on Christmas Day to check on them. His surgical team was the focus of a 2002 TV documentary series. And then it all came crashing to a halt. In 2004, he died of an intentional overdose of oxycodone and alcohol. The hospital CEO said, "Some would say that they saved 98 out of 100. He looked at it and said, I lost 2 out of 100. That's the sort of pressure of some people. They do brilliantly, and then ultimately it comes back to bite them. And then, of course, there are relationship problems, whether it's being overcritical of others or overcritical of oneself. Perfectionists tend to leave a little bit of a trail of broken relationships behind them. Scrupulosity, I've mentioned briefly, and of course that is common in Christians, to be over scrupulous in keeping the law. And then there's a strong association with obsessive compulsive symptoms and OCD. Now, the roots of perfectionism that we move on to, there is quite a strong genetic, and you see this in small children, a temperamental predisposition to wanting everything just so, whether it's tidiness or cleanliness. We feel the pressure in our own culture, our subculture, and of course the military and medical subcultures need a certain amount of perfectionism and high standards. That's appropriate, but they can go too far. We've mentioned the social media pressures, but that perhaps the strongest seems to be in our families. The example, the parental expectations and criticism, the shame and the abuse. I think of Joseph, who was Chinese American, and his father was incredibly hardworking with high expectations. His mother could not receive or give compliments or encouragement, and both of them disciplined their children freely. And Joseph said, everything that I do must be done right. If you do things right, you always succeed. If there is failure, something was not done perfectly. This standard helped me to do my best, but it has also caused great grief and debilitation. I'm dogged by fear of failure. And this might go on into school as well, into high school and then into college, this sense of being criticized by others. And of course, I had one client whose father always noticed the things he got wrong when he mowed the lawn. His father wanted, his mother was very obsessive about making the bed the right way. Might be a family where a child spills a glass of orange juice at the breakfast table, and the parent berates them with, "You're always such a klutz, you're so clumsy." So the classic sort of exchange is love for grades. And that is a pretty lethal combination in generating perfectionism. There was an article in the New York Times back in 2015 about what was called the triple bind for college students on the East Coast. They had to be pretty, sweet, and nice, be athletic, competitive, and get straight A's. In other words, to be impossibly perfect without any effort. And this led to quite a high suicide rate on the campus. So to summarize, the roots of unhealthy perfectionism, they come from shame, the absence of approval, or from active disapproval and criticism. Brené Brown, the author of The Gift of Imperfection, says, perfectionism is a self-destructive and addictive belief system that fuels this primary thought. If I look perfect and do everything perfectly, I can avoid or minimize the painful feelings of shame, judgment, and blame. So the fear of failure, of rejection, of loss of control is a common theme. And then finally, the old-fashioned sin of pride, of wanting to feel superior, wanting to be superior to everyone, can be a part of this mix. So we've looked at the thought patterns, the roots, the social pressures, and then just a few words about the practical strategies for health, learning to live, because what it is about, it's learning to live with imperfection. So and Rob Waller goes into this more in his webinar, evaluating the pros and cons of perfectionism. Most perfectionists think that what they think and do is normal and is what everyone else does or should do. Recognizing the all or nothing patterns in one's thinking, catching oneself, keeping a journal of thoughts and feelings. So these are all sort of self-awareness, becoming aware of one's feelings and the fears of loss of control, of anxiety. And then resisting the lies, this is into the thoughts that we tell ourselves, that you have to get this just right. You have to get 100% in that particular task. And it's moving from idealism, which is what perfectionists are, to living in reality, where most things are not perfect. It's accepting that change comes day by day and little by little. That is very hard for perfectionists. They don't know how to live in the world between all or nothing, between bad and good. So it's helping them to work on small goals. Just to give a quick example from Mark Antony and Richard Swinson's book, learning to be less perfectionist about your physical appearance, that's too big a goal. So you have to break it down into no more than 30 minutes getting ready in the morning, missing a workout in the gym, being willing to gain 5 pounds without being upset. It's learning to tolerate anxiety, or becoming more tolerant of others, stop caring how they wash the dishes, how they load the dishwasher, tolerate a spouse or a friend arriving late, allowing children to make a mess, learning to tolerate anxiety. Now that is the key thing. It's learning to lower your standards a bit and be and learn to live with the anxiety and accept that it's okay. And this is really hard for the perfectionist. This quote by Saltzman from an article some years ago about the ambivalence to change is very powerful. When the perfectionist discovers that instead of making him a Superman, therapy attempts to strengthen his humanness and get him to accept his imperfections, he is both angry and disappointed. Instead of an anxiety-free existence in a state of perfect living, he discovers that therapy will only help him to live with anxiety in an imperfect world in which control is. Such goals are so alien to him that he considers himself a failure for even approaching them. You can feel the complexity of thinking in this, of wanting an anxiety-free existence, wanting to be perfectly in control, and having to accept that that's not going to happen. We are fallen creatures, we're imperfect. Now, all of the things that I've said so far are dealt with in the secular literature on perfectionism, and dealt with well. The need for change of thinking, the cognitive behavioral techniques that are involved in that. But there are some bigger questions that we need to consider. And these are especially true for those of us who are somewhat philosophical and theological in our thinking. So there are bigger questions about the nature of reality. In other words, what story do we live by? Is it the evolutionary psychology story of evolution, chance, and time? Its own story of who we are, how we got here, what went wrong, and how things can be set right? Or is it the story of an impersonal God or energy, or perhaps something like Buddhism? Your essence is perfect already if you could wake up and live in that reality rather than getting caught in your ego and self-protective mind. The third, of course, is the Judeo-Christian view of a personal God and being created perfect, having fallen from that and being restored by our Creator with a memory of perfection in the past and a longing for a perfection that's going to come in the future. So these beliefs about values, about appearance, about performance, about productivity, they're all good. And you could say, well, these are all gifts that God gives us. He makes some people more classically beautiful than others. He gives some people incredible athletic or mathematical gifts. He enables some of us to be very productive. But they are not the source of our fundamental identity. And they can become much too important. And Jesus, in the Sermon on the Mount, speaks of what's really important in your life. You may value your home and your furnishings, but little moths will come. You may value your nice Lexus, but eventually rust will creep in. Less nowadays than it used to, but it will come. And as you get older, we bump into reality. From my sort of mid-40s, it felt a bit like this. The downhill slope with ups and downs along the way. And the Bible says poetically that we cannot escape the fading glory of old age and death. The beautiful actress may die in the throes of dementia, having lost all her beauty and all her memory and mental powers. So our beliefs about the nature of perfection are incredibly important. And this is where we go to Jesus' classic verse in the Sermon on the Mount of be perfect. That feels like the verse for perfectionists. But what did he mean? The word means, it's not a static definition like flawless or mint condition, an achieved goal. It's from teleos, that for maturity, a work in process. You are becoming perfect. Go on becoming perfect, Jesus is saying. And our appearance, as we said, our possessions, our performance, all good things and valuable and excellent. But more important thing, it seems to me that Scripture is saying to us, is that character development and relationships with God and with other people. So what is really important is being a good steward of the gifts our Creator has given. Develop, learning to, becoming truly human, living in a relationship with our Creator. And we know that all the great religions of the world have this common awareness of the need to be better. And they all have a path of try harder. But the Christian path is different. Living in a personal and moral universe, God tells us you cannot achieve this perfection on your own. You need rescue. And a loving God has come to rescue us, to accept us just as we are, and to gradually work in us and transform us by his grace. Grace is the answer to this. Now, if this is true, our fundamental worth and identity do not depend on our appearance and performance. When we know we're accepted and loved with all our imperfections, we're set free to pursue excellence without fear of failure or rejection, and with gratitude to our Creator. Do you remember that film Chariots of Fire? Eric Liddell runs to use his gifts well. He's a believer and he loves his Creator. He wants to use his gift of running well. His chief rival, Abraham's, runs to win. And he says, if I can't win, he says, I won't run. I think in Abraham's there's a deep fear of failure. And our desire to be excellent comes from a motive of love for God, not fear of failure. So letting go of unhealthy perfectionism, which says to you, I must be in control. It says, I'm terrified of failure and rejection. It says, I am what I do and how I look. It's gradually learning to let go of those and become what many of my patients or clients have told me, I'm a recovering perfectionist. Their intensity and frequency of these core beliefs subsides. One young woman said to me, I'm slowly overcoming my unhealthy perfectionist tendencies through a very healthy marriage. My husband's unconditional love and constant affirmation have tremendously helped me to tackle my struggles with low self-esteem and an unhealthy desire to hide behind my perfection. I'm gradually being freed to be myself, flawed and imperfect. So it is about a relationship with God, a relationship with people, a relationship with self, experiencing others accepting you, whether it's in a small group at church or playing a game of volleyball with the worst hanging out. The movie that I show you there, mostly Martha, you need to see it in the European version. There is an American one, but it's a good illustration, a common grace illustration of this. And I want to finish with two quotes about the healing of shame and the desire to be perfect. This is from The Velveteen Rabbit. You may remember back in childhood, the well-used toys were in the nursery. What is real, asked the rabbit one day when he and the skin horse were lying side by the nursery fender. Does it mean having things that buzz inside you and a stick-out handle? Real isn't how you are made, said the skin horse. It's a thing that happens to you. When someone really loves you, then you become real. Does it hurt, asked the rabbit. Sometimes, said the skin horse. But when you're real, you don't mind being hurt. Does it happen all at once, like being wound up? It doesn't happen all at once, said the skin horse. You become. It takes a long time. And that's why it doesn't often happen to people who break easily, or who have sharp edges, the perfectionists, or who have to be carefully kept. Generally, by the time you're real, most of your hair has been loved off. Your eyes drop out and you get loose in the joints and very shabby. But these things don't matter at all because once you're real, you can't be ugly except to people who don't understand. Now, I hope you can tolerate one more quote before we finish here. This is from C.S. Lewis, Mere Christianity, about the hope that we have of perfection, because it is a real hope. The command to be perfect, he says, is not idealistic gas, nor is it a command to do the impossible. He is going to make us into creatures that can obey that commandment. He will make the feeblest and filthiest of us into a god or goddess, a dazzling, radiant, immortal creature, pulsating all through with such energy and joy and wisdom and love as we cannot now imagine, a bright stainless mirror which reflects back to God perfectly, although of course on a smaller scale, his own boundless power and delight and goodness. The process will be long and in parts very painful, but that is what we are in for. Nothing less. He meant what he said. So that is the end of my presentation. And here I put up the books that Rob mentioned in his webinar, if you didn't get them at the beginning. So thank you for listening, and I look forward to any questions that you have.
Richard, that's wonderful. Thank you ever so much for that fantastic presentation. You did a great job cutting down so much material into that short presentation. And I was reminded of so much as you went through that. I think your book that you've highlighted there was published back in 2005, and I read it many years ago, and I'm reminded of so many of those principles that I've tried to apply in different ways over the years, which has been a great help. How, in terms of our questions, and do start putting questions into the Q&A. We've got 3 in there at the moment, and it'd be great to get some more of those in, and we'll go through some of them. One of the top questions there was about that verse in Matthew 5, verse 48, about be perfect. I think you've dealt with that very well in the slide as well, that it's not just about perfection in standards, but that what do we mean by perfect is a really good thing to be aware
in the
of.
Context, in what we mean by it, in what Jesus meant in the context of what he was saying, because he was setting in the Sermon on the Mount incredibly high standards, but in a way then demonstrating that we couldn't achieve them ourselves. We needed the righteousness of Christ to make us righteous, to make us perfect. And that's the sort of difficulty of getting our head around. In one way, when we are accepted by God, we become Christians, we are given his righteousness, his perfection, but we don't achieve the fullness of it in our experience until we are made perfect in glory. And that is the go on becoming perfect.
Yeah. No, thank you very much. How would you advise someone who's trying to balance that desire for high standards with a tendency towards perfection and the need to get productivity? Because as doctors, we do want to obviously work with high standards, and we need to. And how can we try to balance those things up day to day?
That's the big question for all of us. I think it's, each individual has to face their own heart and actions and thoughts and emotions to evaluate and this is where we need help from others, I think, because we don't see ourselves very clearly. What in me is healthy striving for excellence? And it might be that there was one client of mine who was an excellent school teacher. She was absolutely brilliant, and she got lots of her students into really good high schools. And but she would stay up until 2 a.m. preparing lessons every day. The parents loved her, the teachers loved her, but did her husband love her? Well, he loved her, but he was not very happy. She never went to bed with him, at the same time. And she slept a much shorter night than he did, and she was often pretty exhausted. And all she could think about was school. So there was a pathological perfectionism in her. And her husband was one of the people who helped her to see that, because she bumped into reality in her marriage, and you might bump into reality in other areas of life.
And was she able to learn from that bumping into reality?
Yeah, I actually quoted her at the end there about becoming a recovering perfectionist.
Great. So was she going to bed only at 1:30 or were you...
Goes to bed. Well, she has two little children now, and she goes to bed at about 9.
Yeah. Yes, I think putting some of those, I love that thing about what was it, no more than 30 minutes for a workout, or getting ready and missing a
Getting ready in the
workout.
morning. Yeah,
That's right. I love to set myself these somewhat artificial deadlines, as in I'm going to work on this talk until this time and then it's done.
I think that's what you have to do. You have to set deadlines and maybe have other people help you set them.
Yeah.
But that's a huge battle within, and it might be through another way, especially with doctors, I think, would be workaholism,
Mm,
affecting their marriage, affecting their children. They're never
mhm,
home to see their children,
yeah.
but they have very high standards of how they care for their patients, but it's not quite the same values at home or in. So I think that the the rub really comes in relationships for
Mm,
perfectionism. You can keep up very high standards in your practice, but when it comes to your patient, those actually interfering with them, the high standards in your practice.
mm. That's right. Another question that we've got here is about those high standards and asking whether that changes between different medical specialisms. Presumably, if you're a brain surgeon, then high standards are incredibly important.
Yeah.
Some things like general practice for myself and psychiatry and some others may be able to be a little bit less precise in some ways, and yet you can still be uh, an unhealthy perfectionist in all those ways. So how might that vary between different specialties? Is there a better specialty for a perfectionist to go into?
That's a great question, because yeah, you're right. Perfectionists tend to be attracted to the ones where they can be more precise and exact.
Mm,
So they wouldn't be so attracted, say, to psychiatry.
mm,
There is a high rate of suicide amongst psychiatrists, and that may be partly when they are attracted, then they find they can't be so precise. It's frustrating. But yeah, I would like to have a perfectionist neurosurgeon, or a perfectionist to be a little more mundane window cleaner. There are some occupations where you want people to have high standards. But as I said earlier, if that neurosurgeon then goes home and tries to be as exacting with his children and his wife as he is with his surgical team, he's going to get
mm.
into trouble. Um,
Yeah.
so, yeah, I mean, um, I think any surgeon has to try to be pretty precise. Less so with medicine and perhaps geriatrics and psychiatry and all of that. And being a GP, I still want you to be a really good GP and have high standards, but
Mm.
not so much that you don't take into account the personal relationship with me and take time to talk to me.
Yeah, and you can spend all the time writing perfect medical records that no one could ever sue you for, and never getting through your clinic.
Yeah,
So there's always room for it, isn't there?
yeah.
There's a couple of questions from Shanta and from John, similar things. So, how do we distinguish conscientiousness from perfectionism? And how do we work out when the ambition that we need to excel in our careers is crossing over into unhealthy perfectionism?
Mm, mhm. Well, conscientiousness is one of the factors in personality testing
Mm,
that is it's a sort of named factor in the 5 factors of personality, which comes out very strongly in perfectionists. So, and like perfectionism in itself, conscientiousness is a good thing. I want people to be conscientious about moral standards and about their
mm,
behavior and so on. but it can go over into a scrupulosity and a legalism that is over conscientious, super conscientious, whatever you like to call it. And some people get really caught in that with obsessive compulsive ruminations and rituals that they have, committed some sin, done or cheated someone. Or I remember a doctor friend of mine, a GP friend of mine, who sadly now has died. He had very depressed, as is quite common after a stroke, and he was ruminating all the time about a patient that he had treated badly when he was young. Now, I think that he was a perfectionist who was ruminating super conscientiously in an obsessive way about this in his depression. So conscientiousness is a mixed blessing. And on the second part of your question, I think I've sort of answered that somewhat already. And I guess you're talking more now about ambition, aren't you? Can you just repeat that part of it?
It was, when does the ambition required to excel in a career cross over into unhealthy perfectionism? I guess there's that ability to say, when have you crossed that line? When do you need
Yeah,
help, and how might you get there?
I think it's that crucial thing of when your identity is totally tied up in achieving your ambition. So it's the sort of the saying that the way you think about it is, I will not be happy unless I become professor at such and such a hospital. That is my goal, and I'm going to do it, and I'm going to
Yes.
live for it. Now that is making a god. It's making an idol out of your career. Whereas if you just want to do a really good job and you want to bless people with your surgical gifts or medical gifts, and you want to be someone person of excellence in that, but it's not the totality of what you live for, then that's a more healthy approach to it, I think. Does
Yeah.
that make sense?
Yes, it does. It does, absolutely. Thank you. Another question here is about, how do we reduce indecisiveness and procrastination related to perfectionism? I'm glad that the questioner didn't take too long formulating the perfect question, but they got on and did it.
Right, right. Yeah, this is an area where I have a little bit of an Achilles heel, I think, in maybe part of my interest in perfectionism is it in major decisions in life. I get very anxious, and I think it's that desire to make that perfect decision. And it's easy to procrastinate and put it off. And there is an element in which you just have to be pretty tough going through difficult decisions in life. You have to pray, you have to use your common sense, you have to talk to friends, get wisdom from them, and you have to make a decision and trust that God will lead you in that. And I think when in one time when I was in turbulence about this, the Lord seemed to be saying to me, not in an audible voice, but, Richard, I've made you a choice maker. And that is a gift that I have given you. And whichever way you choose, as long as it's not morally wrong, I will go with you. So I think, some perfectionists get hung up on, there is the perfect person to marry, or there is the perfect career for me. And I don't think that that is true. I think there are a number of different options for all of us, and God will use us. This is the divine mystery of God's providence and guiding and leading and our choices. But He's made us significant enough that we can make very significant choices in life, and we have to make them with courage.
We do. Is the all or nothing thing, you've mentioned that a number of times, and
Yeah.
I'm always, well, do you come across people who say, well, I used to be a perfectionist, but I've got that completely sorted now?
Completely sorted. um, I don't actually meet many people who say that. No, they do when they set out on the path of confronting their perfectionism, they get very impatient that they're not made perfect within a few days. The
Yes.
thing isn't sorted, but gradually I was going to say lapse into, they go into a more realistic recovery mode, that I'm a recovering perfectionist, and it takes
Yes,
time.
it's a great phrase to use, isn't it? Like the recovering alcoholic, you're always struggling against it, aren't you? You know you can fall it each day. Do you have any advice for perfectionists working together when you have two perfectionists in a marriage or working together? Um, I mean, the reason I tell you that story, I had a funny story from doing a seminar, the CMF student conference with my wife, who's also something of a perfectionist, and we were basing it on largely on sections from your book, and we had some really big arguments about how, what was the best way to do the perfect seminar, essentially. And so we know when two perfectionists clash, that can be particularly hard.
Yes. And two perfectionists, or a perfectionist and a very non-perfectionist, that can be a joy, or it can be a terrible pain.
Mm.
Um, but yeah, I'm interested in that example you give, and presumably you were each had your own perfectionist standards and perfectionist ways of doing things. You didn't come to a common, perfect way of doing it. That was
Um,
you clashed.
Certainly we divided up the sections, but it was only when it said, no, you're not doing your section the way you should do. That was the tricky bit.
I
But
don't have any easy
we found a
answers.
way through it.
You did. Well, maybe you should tell us how you did that, because it's not an easy, it's sort of negotiation, isn't it?
I think, yeah, I think it is, and often being able to talk about it and then and laugh about it sometimes as well. And yeah, sort of, I guess, staying in your lane. If there's something that particularly bothers you but doesn't bother the other perfectionist, then perhaps you can divvy things up a little bit more and learn not to clash too much with it. That's certainly things that we've found helpful.
Yeah,
Um,
yeah. I
Maybe
think
the
that,
last go on.
okay, no, you go ahead.
Um, well, maybe the last question is one that's in here. Is it genetic or is it nurture? What about tiger parents? Is it either or both?
Yes. I
So
think
that's
it's,
from Potin. So I think that's an East Asian question, isn't it? Which I think must be very pertinent.
one with the example I used, I think, in talking about family was Chinese, at least Asian parents. Um,
Mm.
and I think it is both. And I think some children are born with a tendency in that way. And if they grow up in a very perfectionist, critical household, then it just amplifies that tendency. Whereas if they grow up in a household that's much more easygoing and laid back, hopefully they will become less perfectionist in their way of approaching things, and less damage will be done. And I think so. I parents sometimes ask me about, how do you raise a perfectionist child? Um, and I think it is just offering them grace, and grace and more grace. That you don't. The message is, you don't have to be perfect to be loved by me. I love you just as you are, whatever way I may, you know, be stop you doing some things because it's not good for you, but I love you anyway. And I think that's God's, the ultimate key to unlocking the prison of perfectionism is grace.
I think that's a great place to finish on, Richard. Thank you very much.
Okay.
So there was another question that just come in about perfectionism in different cultures, and I think we've talked a little bit about how things work out. I'm sure there's a great body of research on that, and it would be great to talk more if we had longer. But thank you ever so much, Richard. You've done let's say a more than good enough seminar there on perfectionism, and that was really wonderful. So thank you ever so much for doing putting the work in for that, and for presenting to us and answering those questions so well. And thank you to all of you who have come today. I hope you've enjoyed the webinar as much as I have. And so it just falls to me to say, may the Lord sustain and guide you in the week ahead. and may your motto be aim to be adequate. Thank you very much, Richard, and thank you, everybody.